The Cannulation Simulation tool is a visual aid to help clinicians understand the concepts that cause peripheral IV failure. When we discuss these concepts, they're abstract and difficult to grasp. These demonstrative tools provide the aha moment for the clinician and will help them to make better choices with device and site selection. The kit contains a simulated vein with the hole at the top to insert the cannula and a smaller hole on the back wall to demonstrate transfixing the vein, with the stylet that is included in the kit. One cannula per kit will accommodate the stylet. 4 of the most common cannula sizes can be found in the kit, though a larger gray 16, an orange 14, and a small 26 gauge cannula can be ordered. Catheter to vein ratio. In order to demonstrate catheter to vein ratio, first place a large catheter into the vein, showing how the cannula fills the lumen of the vein. Point to the area behind the cannula where blood will pool, unable to flow freely around and past the cannula. Highlight the friction of the cannula on the intimal wall of the vein, contributing to mechanical phlebitis. Then point to the tip of the cannula where the medication is delivered, and the clinician will quickly understand the medication is delivered full strength without the benefit of good hemodilution, where the blood would normally buffer and help prevent chemical phlebitis. Point out with this cannula that the exit site is larger and more susceptible to bacterial phlebitis. Using this large catheter, move in and out of the vein to demonstrate lack of securement or placing at a point of flexion, where the cannula pistons in and out, pulling bacteria in and out of the exit site, as well as causing mechanical phlebitis along the vein. Remove the large cannula and insert a small one for comparison. Again, point to the area behind the insertion site, along the cannula, to the tip where medication is delivered, showing there will be better hemodilution and less risk for chemical phlebitis, as well as less risk for mechanical phlebitis. Vein purchase. Insert about 1/3 of a cannula into the vein. Explain how the tip of the cannula may abut the vein wall, causing irritation or even damage to the intimal wall, and could possibly create a wall shear stress, where the flow of the infusate is aimed directly onto the vein intima. Advance that same cannula to 60% of the length lying within the lumen, and it is easy to see how the tip of the cannula will be pointed in such a way as to deliver the medication parallel to blood flow. Explain how increasing edema in the overlying tissues could pull the cannula out of the vein by slowly removing the cannula. This explains the need for a 50 to 60% of the cannula length to be within the lumen of the vessel. Tip position. Insert the stylet into the cannula to demonstrate 3 common faulty tip positions. The first is failure to advance, where the stylet tip may pierce the vein, but the catheter does not advance into the lumen. It is possible to get a nice flash of blood, but this cannula is not intravenous and will not be able to safely infuse the therapy. Advance the stylet through to the small hole on the back wall of the vein to show how easy it is to advance too far. Again, there might be a strong flash of blood, but the cannula tip has passed the lumen of the vein, and therapy could be delivered partially in, partially below the vein, or completely below the vein. Even if this insertion is salvaged with the cannula advanced into the vein, this injured site can be leaky and cause failure of the peripheral IV site. Angle of insertion. Insert a catheter with a high angle of insertion to demonstrate the difficulty of turning the corner with the cannula, the challenges in securing this device, as well as limiting vein purchase, as too much length has been used traveling through overlying tissues. Point to the area where the cannula will be in contact with the vein wall, creating friction, which can lead to mechanical phlebitis and failure of the peripheral IV. Insert a smaller cannula with greater than 50 to 60% vein purchase to demonstrate how a lower angle of insertion allows for less mechanical irritation, can allow for greater vein purchase, can potentially reduce wall shear stress by allowing the delivery of infusates parallel to blood flow within the limit.
All of these concepts are described in the accompanying book, Why Do PIVs Fail?, which can be purchased separately along with full kits and replacement components at p-iv.net.